Hello, my name is Carolina Paranto. I am an LPN in the LPN to BSN program at Indiana State University, and welcome to my presentation on Medicare-aged adults and their health care in Texas. Our learning objectives for this video are: at the conclusion of this presentation, the viewer will be able to classify a population at risk and how an individual 65 years or older who lives in Texas fits into this category. At the end of the video, the viewer will be able to explain how to apply leadership skills when providing quality health care to the patient. At the conclusion of this presentation, the viewer will be able to identify how to apply leadership skills for emergency preparedness, and at the conclusion of this presentation, the viewer will be able to explain how to create a lifelong learning plan for professional nursing practice and analyzing healthcare policies. At this time, if you will pause the video and complete the pretest and take a look at the accompanying handout. Once you have completed that, please play the video and continue on. What is a population at risk? A population at risk is a population that is at risk for adverse health issues and also chronic issues. Our population at risk today is older adults who are 65 years or older, or also known as Medicare aged, who are living in Texas. Some interesting facts about Texas are, according to the United States Census Bureau, 12.9% of the population in Texas is 65 years or older. That is a large majority. The population per square mile is 96.3 people per square mile. According to the United Health Foundation, Texas ranks 50th in the nation for clinical health care. This ranking takes into account preventative clinical services. It takes into account the amount of providers in the state, the annual immunization rate, and the quality of care. Texas also ranks 50th to access to health care. Texas also ranks 50th for avoiding care due to health care costs. This is important because a lot of preventative measures are missed due to a patient not following up and getting checked out when they're having health issues. Texas also ranks 49th for providers per population, 47th in the nation for primary care providers, which is 91.7 per 100,000 people per population. This figure takes into account internal medicine, family practice, nurse practitioners, PAs, geriatric medicine, pediatrics, and OBGYNs in the area. When looking at this figure, it shows that there is one physician per 521.7 people. This also does not take into account the different kinds of specialties, meaning there may be more pediatric versus geriatric physicians, or vice versa. Texas is also 49th in preventative screenings due to lack of access to healthcare and avoiding healthcare due to healthcare costs. Patients are not getting their colorectal screenings, mammograms, and other immunizations and preventative screenings, which can help in reducing healthcare costs and catching diseases before they become uncurable. Texas is also 47th in having a dedicated healthcare provider. 68.1% of the population in Texas has a dedicated healthcare provider. And in the 65-year and older population, they are 40th in dedicated healthcare providers for this age range. For this population in Texas, 91.7% of 65-year and older populations have a dedicated healthcare provider. In comparison, in the United States, 93.6% have a dedicated healthcare provider. This is very important because there are a lot of healthcare needs that are being missed, and also there are lots of rooms room for opportunities in Texas to get better health care to this population who is at risk. So what can we do in nursing? In nursing, there is leadership in nursing that can help with fixing these issues by taking a look at the community and what can help to benefit the community. Why are they having such poor rankings in quality of health care? In nursing leadership, it's very important to always make sure to take a look at trends and where can things go better for populations at risk? Where are areas of opportunity for patients to learn and to reach these patients who need help? It's important to analyze healthcare policies. What is working? What can be improved? What can we do to make healthcare better for these minority at-risk populations? Using nursing leadership skills, nurses can take a look at what are some things that we can do to help with emergencies in these populations. Very recently, there has been a giant blizzard and snowstorm in Texas, which knocked out power for patients. What can we do in these older populations to reach them, to help them with their healthcare needs, for help with emergency preparedness, how to prepare them in case of an emergency with diabetic supplies, with other hypertension medications? How can we help them so that there is not any issues when an emergency that is unforeseen arrives? Some important leadership skills in nursing are transformational leadership skills. They teach other nurses and they lead by example. They take a look at the rooms for improvement and they teach other nurses, this is how you can help. These are community resources that we can use to make this population at risk better and get their quality of health better. It mobilizes groups of nurses to get work completed. It teaches these nurses and gets them out to where they can make the best and biggest impact on the Medicare-aged patients in Texas. Democratic leadership encourages input and communication. It encourages for nurses to communicate to leadership with what is going on, what do you see, what are trends, what can be done better. And servant leadership, it meets the needs of the team. When your nurses tell you that they need more diabetic supplies, these types of leaders make sure that those patients and those nurses are set up for success to make sure that they are ready for any emergencies and that they are able to meet the needs of the community. What is lifelong learning? Lifelong learning means that you're always researching, always looking at trends. Why are these patients having poor healthcare outcomes in Texas? Why are these healthcare policies not reaching certain patients? It's important also to make sure you're always learning new technology for better healthcare outcomes. TV ads and radio ads are technological ways to reach people, to reach their family members, to teach them, and to reach the patients. Application ads on Facebook and other popular applications to help reach these populations. It helps to know the technology for easier delivery of emergency supplies or medications and easier communication such as telehealth medicine. Lifelong learning is never ending and it's always important to stay up to date with new technology and new research. At this time, if you could take the post-test and pause the video. Once you are completed, you can continue on to get the answers to the test. Here are the references that were used in this presentation. Thank you very much and have a wonderful day.